My name's Amy DeZern. I'm Associate Professor of Oncology and Medicine at the Johns Hopkins University School of Medicine in Baltimore, Maryland.
Dr. DeZern participated in the Medalist Trial, a study of luspatercept to treat anemia in lower-risk patients with myelodysplastic syndromes.
I take care of patients with bone marrow failure. I'm a clinician scientist, predominantly a clinical trialist, who treats patients with myelodysplastic syndrome, aplastic anemia, and PNH. They're often transfusion dependent with cytopenias, and it can be a very significant clinical problem at the bedside. The Medalist Trial was a phase 3 study conducted internationally in very low, and intermediate risk transfusion dependent ring sideroblast positive myelodysplastic syndrome patients. And this was a 2-to-1 randomization of luspatercept to placebo in human patients who met that eligibility criteria. It's a very exciting potential new drug in our field, and just by way of background, there's only 3 approved drugs in all of myelodysplastic syndrome, so we're very hungry for a new agent for our patients. It's been 12 years actually since we've had a new approved agent in the myelodysplastic field. And luspatercept is a placebo-controlled trial that has been positive. As a phase 3, it was a randomized trial whose primary objective was to show that they could decrease transfusion burden of red cells in these lower risk MDS patients. And at interim analysis, and the results that were presented showed that luspatercept compared to placebo was significantly better at achieving transfusion independent endpoints, but also raising of hemoglobin endpoint and transfusion burden decrease. The most noteworthy finding is the transfusion independence at 8 weeks. This seems to be durable. There are some patients with responses over 12 months. The limitation certainly is that while in a chronic disease with a paucity of therapies, 12 months is great, but we're certainly looking for further durability, and we need to see about evolution to AML and some of those rates later on as other outcomes for our patients. But I think more data will come as the study matures. Luspatercept is a very non-toxic drug. It has very few treatment-related adverse side effects, which is great. You know, the clinical implications are to be able to raise the hemoglobin, decrease the transfusion burden, presumably increase the quality of life for our patients. People are very enthusiastic about this drug. It has this utility in MDS, and it's also been studied in beta thalassemia, another transfusion-dependent disease. There's many outstanding issues as it relates to how we care for our MDS patients. Certainly this drug appears to have a particular relevance in both lower risk, but more specifically MDS with ring sideroblasts and SF3B1 splicing mutations. And I think it will be very interesting to tease out further if there are molecular subtypes other than the SF3B1 patients who seem to respond better to luspatercept. I think this was a very positive study in an area of great clinical need with low toxicity for luspatercept, so I think it's quite promising, and we're all very hopeful that it will be the 4th approved agent in myelodysplastic syndrome.